Good afternoon, everyone, and welcome back to Silver Oak Health's open sessions. Today, we will be talking about unpacking the link between addiction and mental health. And our uh, expert audience here would be able to, expert participants and experts here will be able to share with you. One of our experts is Anne. She's the Chief Clinical Officer of Silver Oak Health. She's a clinical psychologist with over 15 years of experience across clinical and corporate settings. Her work focuses on psychological assessments and interventions with a strong interest in neurocognitive aspects of human behavior. She's trained in CBT, REBT, DBT, integrated psychotherapy, and many more approaches and therapeutic techniques. She was previously the head of the psychological services at Silver Oak Health and have also worked with multiple different organizations to be able to adapt psychological tests and make sure that they have a great working environment. Our other expert here present today is Dr. Rohit Garg. He's a senior consultant psychiatrist and founder at Ganaa. He is a renowned psychiatrist and social entrepreneur dedicated to advancing mental health and de-addiction care in India. As the director and senior consultant psychiatrist at Mind Viriksha Clinics, founder of Ganaa, a leading de-addiction and mental health rehab chain, and co-founder and medical director at Abhasa Rehab and Wellness. He has impacted countless lives through his clinical expertise and compassionate leadership. In fact, all of my interactions with him have been extremely positive, and he is a great expert to have. So please do hear what Anne and Dr. Garg have to say to you here, because it is important that we unpack the link between addiction and mental health. With that, I will pass this session over to Anne. Thank you so much, Anne, for your time. And thank you so much, Dr. Garg, for your time as well.
Thank you.
Thank you, Janvi. So as Janvi mentioned, today we are going to speak about addictions as a whole, whether it is any substance, including alcohol, nicotine, opioids, or screens and other addictions like gambling also we will be touching on. So there was a study published by the National Drug Dependence Treatment Center of All India Institute of Medical Sciences, Delhi in 2019, which looked at different psychoactive drug users and looked at it and said that alcohol is the number one drug used across India. And according to their study, there are around 16 crore users of alcohol, 5.7 crore problem users, and 2.9 crore dependents or who are addicted to alcohol. So with this note, I would definitely turn to Dr. Garg to explain to us little more in detail how does a habit or a social drinking pattern become an addiction, or how does it get diagnosed as a addiction, which could be a mental health disorder in itself.
Yeah. So thank you, Anne. And first of all, thank you, Silver Oaks, for bringing, this very, very important topic, which is addiction in today's day. And its association with mental health, which is again very important, in today's day-to-day life. So understanding addiction is very important. And, the most common thing what people usually confuse is that they are not having addiction, but it is just a habit, So this is very important, and I would advise everybody to listen to this very carefully, because this is how you will be able to differentiate whether you need help or you're okay to go ahead with whatever you're doing. So in general, how does a habit turn into addiction is, for example, there is a person who goes for a party and he is a little anxious person and he happens to consume one or two drinks of alcohol. And now he's feeling better, his inhibitions are gone. He enjoys the party. After coming back, he thinks, oh, wow, it was a great outing and evening. It was different from the, last parties that he has attended. So he starts using that, his brain starts asking for that kick, every time he goes for a party. But he does not realize that slowly and steadily, he wants the similar kind of a relief, or a happiness or a calmness when he's back home alone as well. And slowly the habit starts turning into addiction. So what is habit? So habit is something that you have a control over. I mean, you can start with it and you can stop it whenever you want to. But when it comes to addiction, to be very, very truthful, it is not a choice. Your habit has turned into a disorder and you have lost control over it. For example, you decide to take 2 drinks, but you end up taking 4 drinks at a party. You decide to use it once a month, but now you are using it every week. So the frequency has gone high, and in spite of you thinking that you can control it, you are not able to control the quantity or the frequency. The second most important differentiating factor is that usually your habits, don't have major negative consequences in life. They might be having mild kind of a negative consequence, which we can all manage, and they don't have a significant impact on the quality of life. But when it comes to addiction, there are a lot of negative consequences. Let it be related to your health, let it be related to your social functioning, your occupation, or your behavioral things. So there are a lot of negative things that bring it up, that addiction brings into your life, and you will often hear people start talking about it, that, oh, this is not good, you need to stop, or you are taking too much of it. So you will get to hear more about these negative consequences. The third and the important thing is that usually, habits are learned behaviors. They help us in our day-to-day life. I mean, your brain learns and your brain needs less focus, attention, concentration in terms of doing those activities on a daily life. But when it comes to addiction, there are certain changes in the brain chemistry which leads to a reward kind of a system, that your brain starts looking for that reward or a happiness on a regular basis. The another differentiating factor is that when it comes to habits, usually there are no withdrawals. So, for example, you don't get involved into any habitual thing for a number of days. Your brain is not going to remind you of that. There is not going to be any kind of a craving over there. But when it comes to addiction, your brain actually starts craving for it. It starts giving you signals. There might be withdrawals in terms of anxiety, depression, sleep issues. So there are a lot of these withdrawal things which are pointing towards addiction, not just a habit. And another important point to differentiate is that when you talk about the time that it consumes your day-to-day life, when it's habits, they do not consume much of your time. It's like a minimum time period that you spend into your habits. But when it comes to addiction, your mind is constantly preoccupied with the thought of getting the substance, taking the substance, and then getting out of the effects of the substance. So your mind is constantly thinking, like, for example, there was a patient of mine. So he would be at work, his work timing and shift would end up at 6 o'clock in the evening. But by 5 o'clock, he would start thinking, oh, when will this end? And how will I procure? And then where will I go and drink? Should I go back home and drink alone, or should I make a plan with my friends? So that's how your mind starts getting preoccupied with the thought of consuming or using the substance. Various habits. Let us talk about gaming, social media, vaping, any kind of drugs, alcohol, nicotine, cannabis, opioids, prescription-based drugs, gambling, porn. So they can be your habits for a period of time. But the last question again, how you differentiate is, you can ask these 4 or 5 questions to your own self. The one is, do you get the cravings? Do you get preoccupied with the thought of using it? Are you continuing to have negative consequences? Does the substance lead to certain emotions like anxiety, fear, guilt after consuming, or you're experiencing withdrawals or physical dependence after consuming it? So if you answer yes to most of these questions, craving, preoccupation, negative consequences, emotional changes, and withdrawals, that means that there is a high possibility that you are not just having it habitually, but it is more of an addiction now. And why it is important to associate addiction with mental health disorders is because in the past, the addiction was only considered as a social problem. Even the authorities who would deal with these addiction problems were different. Like mental health disorders were seen by the healthcare professionals or Ministry of Health, but addiction was mostly dealt with Ministry of Social Justice and Welfare or things like that. So it was always considered as a social problem. But over a period of time, it has been now proven that addiction has got behavioral changes. There are changes in the brain. There are also genetic predisposing factors. Addiction leads to cognitive decline, which is lack of focus, memory, attention, executive planning, and there are also a lot of factors which are common between psychological disorders and addiction. So psychological stressors from the past can lead to addiction, and addiction further leads to these psychological disorders, making it as a loop. So addiction is one of a bigger component today, that we deal with in our mental health clinics or psychiatry clinics. In fact, 50% of the patients who have addiction also suffer from various kind of mental health disorders.
Thank you for wonderfully, summarizing what could turn a habit into an addiction pattern. Just to reiterate and definitely, strengthen the concept that why you should consider looking into your patterns and habits little more closely. I would also speak about control, which Dr. Garg mentioned about, that you don't have control over it. You think it is going to be 1 hour or half an hour, but it is suddenly you're realizing it's gone to 2 hours, 3 hours without you noticing it. So your time, your money, your effort, the time you would have spent on, let's say, studying or focusing on work or family matters, physical well-being, everything comes as a second or third priority, and focusing on the habit which is not healthy for you becomes a priority for you, and it starts getting more and more prioritization in your life is a clear indication that you might have crossed the line somewhere and might have to start taking help and support for us. Yes, because this is a mental health disorder or a condition where you will require professional support and help. So, Dr. Garg, since you mentioned reward pathways, right, from a brain standpoint and a biological standpoint, can you elaborate a little bit on the reward systems and how this pattern in the brain kind of reinforces it in a negative way or a false alarm to the brain and keep on repetitively signaling it that this is where you can get the reward from any of the addictive substances?
So, just to add one more point to that, and like, the control thing, I think it is very important. We always try to limit our app use 15 minutes, 20 minutes, but we keep on extending it. So that is what the control is. And most of the people think that they can control and they are in their limits, but whosoever is watching this, please think in your mind today that what is your screen time, what you think, and you actually, when you go back and check on your phone, it'll be much higher than that. So that is what it is. So coming back to the reward system, so usually in the brain there is something called as basal ganglia. So habits and addiction usually are taken care over there, but in addiction there are other parts of the brain which are involved, like hippocampus and amygdala and prefrontal cortex. They have been proven in the MRI scans and various kind of studies. So whenever there is anything that is giving you a feeling of betterment, that is making you calm, that is making you happy, that is giving you that kick. So there is this hormone that is released, which is called dopamine, right? So when the dopamine is released in this circuit, which we call as reward circuit, so it automatically makes a learning cue, learning cue, because brain is also and mind is also like a living AI kind of a thing. It keeps learning that behavior. Now, when the brain and those areas are not getting that kick and a rush, the dopamine is depleting. So automatically there is a emotional response that happens in amygdala and hippocampus, which could be cravings in forms of anxiety, restlessness, insomnias, depressive state of mind. And that is when your brain starts looking for that reward again, right? And it becomes a loop. Once you take the substance, again the dopamine release and you feel good. And this becomes a consistent pattern, in your brain. And you do not realize when you have slipped from that just using to a addiction kind of a thing. And it slowly over a period of time becomes so strong that, to be very, very truthful, people take years to stop that craving pathway, that reward pathway. And it is very difficult for the brain to forget that, that reward system kind of a thing. So we need to understand that.
Yeah, so like Dr. Garg mentioned, the reward pathway and the biological implication of any addiction pattern, whether it is a substance use, whether it is screen time, whether it is gambling, whether you're just scrolling through your phone to look at different things, it is the same reward pathway which is triggered, and this will also show in your behavior. For example, you might be more irritable, you might be more withdrawn and not be social anymore. You might have a lot of mood swings, basically. This will also impact definitely your social circles and your family, especially because you're withdrawing from the family also, because what is your preoccupation, what is your priority? This addictive factor is your priority at that point of time. And then when these biological, psychological, social factors continue, what happens is that there is an isolation which is happening to you over this time. And then it's like a relationship you're having with this drug factor or a factor of addiction, basically. So to break these patterns, it becomes much, much more difficult, and it is a process involving definitely treatments, including medications, therapy, as well as psychosocial support. So, Dr. Garg, can you explain a little bit more on the medication part for addiction, right? Because if you ask me, a lot of people are concerned about it. They
Yeah.
think that medication is not the right way to stop addictions. They think medications are going to do them harm, but these substances or addictions are not. So you would also have seen in your practice that a lot of people do not want to take medication and try on their own to stop years of habit and addictions.
Yeah.
So can you elaborate why or how medications become an important way of treatment? Not necessarily, it might not be the only way, but it also becomes a crucial part of the treatment journey for addictions.
Yeah. So, this is again a very important concept because regarding treatment related to addiction or mental health disorders, there are a lot of myths and misconceptions around it. And the most important being around medications, because a lot of people come and say, oh, I don't want to take the medicines, I'll have to take them for lifelong, they will have side effects and things like that, right? But the importance of medication, I'd like to explain in various with some examples is, so how many people would understand that excessive consumption of alcohol on one day can lead to a seizure, epileptic fit episode the next day? How many people would understand that a long use of alcohol can lead to alcoholic dementia or memory problems? How many people would understand that excessive consumption or overdosing of opioids or anything can lead to severe withdrawals or complications like delirium and sometimes even death? So what medications do is they prepare you, they create a foundation for you to start working on things. For example, if anybody has got a fractured foot, you don't start with the physiotherapy on the day one. You first relieve the person from a pain, you put a plaster, and once the healing is done, you can get back to your life and you can re-strengthen your muscles. So in a similar way, the first thing is the process is called what we call as detoxification. So in detoxification, we use medicines which are approved by US FDA, or they are used under various medical guidelines to prevent the withdrawals. Now, withdrawals, like I said, can have various complications. So it is to make the process easy to avoid the complications like seizures or delirium, number one. Number two is that we do not have too much of medications which can have an anti-craving effect, but there are certain medicines which have been proven to have an anti-craving effect, like you and me just talked about, that it is very difficult to break this chain of reward system and behaviors. So these anti-craving medicines, if used for some time, they can help you maintain and prevent the relapse. Number three is that, like I said, that these addiction problems also have various other comorbid disorders. For example, if somebody is suffering from anxiety or depression or insomnia, and that was also one of the reasons for a person to, start the substance. So we do need to treat those disorders as well, in order to prevent the relapses. I would like to talk about a case where this person was suffering from alcohol addiction for a number of years, went through various kind of rehabilitations, but then what we found was that he was suffering from this severe OCD kind of a problem, obsessive compulsive disorder. So when we treated his OCD with the help of the medicines after the detox process, I can recall that he's sober now for almost 3 years plus now. So the medicines also help treat other comorbid disorders, which further, helps you remain sober. Then, like you said, there are a lot of other behavioral issues like anger, impulsivity, which increase the substance use. For example, something happened back home, your boss, just became angry on you, or you had a bad day, or you had some relationship or a breakup issue. Now, the first thing which you get is that emotional response of impulsivity, anger, sadness, anxiety. So, and what the brain demands again is switching on back to those substances. So medications also control these sudden impulsive behaviors, which can help you prevent the relapse. And usually these medicines are safe. Usually they don't have to be taken for the rest of your life. And one strong myth which is around the medications is that oh, if I quit substance or any addiction, then I am getting back to another addiction which is a medication, right? So people have this kind of a thought process, but that's not true, because medicines are given under supervision. They are given with the under the guidelines that they are safe to be used. And as you remain sober in your life, you can slowly and steadily taper them off, and you can live a drug free life, which could be medications or any kind of addiction. So there are a lot of myths around this, and I believe that what I tell people is that on a nicotine or a cigarette pack, it is written that it causes cancer, it is dangerous for your health, right? But on the medications, there is nothing like that written. It is only a helpful thing. So one should not refrain from using them if they are given under medical attention and prescribed by a professional.
So, thanks a lot for that, Dr. Garg. So, definitely, when we are speaking about prescribed medication, it is not intended to cause you any harm or long-lasting addiction patterns, as opposed to non-prescriptive and psychoactive drugs and any other factors which is causing you addiction to it. So, since Dr. Garg, you also mentioned about myths and misconceptions, one of the major misconcept or a myth which I have come across in my practice is that people usually say, especially youngsters who are in their early 20s and everything, they consider cannabis or marijuana use as very normal because according to them, it is a natural thing, right? It's a plant, it's a herb. So they try to rationalize and say that, listen, it is not, it doesn't impact brain. It is not causing any addiction pattern. So there is a misconcept among especially youngsters that it doesn't cause addictions. However, This is also a drug or a substance which can trigger the reward pathway, whichever can trigger the reward pathway unnecessarily or not when it is appropriate to be triggered. What happens is that can lead to or cause addiction. That is a biological factor to it. That is the same biological factor to screen addictions or gambling addictions as well. When you cannot stop it, when your reward pathway is craving more and more of it, it is an indication that this also can cause addiction, and it's not only substances like alcohol or heavy drugs like opioids that will cause harm to you. So, any other interesting myth or misconcept, Dr. Rohit, since we are speaking on that topic that you would like to bring to the audience's attention?
So, the first, I would definitely want to talk about cannabis use because cannabis use is increasing among youngsters. And there are three things that they commonly talk about cannabis is number one, it is legal in many countries. Number two is they say it is used for medicinal purposes. And number three is it is natural or it is herbal. So to that, I usually tell them that even tobacco is natural. It's a plant-based product, but tobacco or any kind of a betel nut, it is a natural thing, but it can cause cancer. It can cause lung disorders, right? So anything natural does not mean that it cannot cause problems to you, number one. So number two is that all of us have got genetic predisposition to certain things. For example, if 100 people are using tobacco or pan masala or smoking, not everybody gets cancer, right? But there are a number of people who do get that. Now, how to differentiate that? Are you that one person who is going to have mental health issues or disorders? You don't know that, right? So nobody in the world is immune to not having any problems with cannabis or addiction. And legal it is because to prevent the crime. It is not that it is to be used. Why alcohol is legal is to prevent crime and maybe certain government policies around it. It does not mean that you can use it. Number three, that you know, what we talk about is the effects of the cannabis and other things is that it definitely has got a strong association with serious disorders like bipolar disorder, schizophrenia, and a lot of celebrities have come onto the platforms and spoken about how it leads to those kind of things. And when people talk about it being used medicinally, I give a simple example. Crocin paracetamol helps you with fever. But let us say you take crocin or paracetamol without fever, it can cause liver injuries. So yes, if you have disorders and somebody is prescribing you CBD oil or those kind of things, it's fine. But if you're using it on your own and putting that as a reason that it's medicinal, I don't think that's right. It will cause more harm to you. And there are a lot of other myths which I'll just mention briefly, which goes very, very strongly with addiction. Is number one is that usually addiction is considered as a moral failure. It is considered as a weakness that only these people use it, and morally they are not correct. But the truth is that it is a disorder and it is a disease. Number two, people think it is a choice that they can stop it anytime. They just don't want to stop it. But the truth is that even people who want to stop it, they are not able to stop it, and we need to help them out. Number three is that a lot of people think that only hard drugs are addictive. Like they say nicotine, oh, it's not a hard drug. Cannabis, it's not a hard drug. But let me tell everybody here that the most addictive substance in the world is nicotine, even more than anything else. Like you use it once and you have a very high percentage of getting addicted to it. And on the day one, you will not think that you will be smoking a pack of cigarettes a day. You will start with one, but when you reach 10 in a day and 20 in a day, you won't realize. Another myth that people think is that addiction happens to poor people or lower socioeconomic group people, but that's again not true. And they feel that the treatment will not work, properly. And even if the treatment is forced, it will not work. But that's again false, because that's what we talked about. Once you get the person to the treatment and they feel better, they are more motivated to work on that. Another important myth which people talk about is that relapse is a failure. And I mean, even the family members respond to it like that. Like, you have been sober for 6 months and you take it one day and everybody panics. Oh, ye kya ho gaya? He will not change. Ye to badlega nahi. And it's a panic, and they consider that he has failed and he will never ever get well. Ye to sudrega nahi. But failure, relapses are a part of the recovery, and people, slowly and steadily get out of it. you know and people also have a myth and misconception that addiction is only because of stressors or external factors. Like, there was a patient of mine, he would come and tell me, sir, if my wife starts behaving properly, if she comes back home, she has gone to her parents, I will stop drinking alcohol. But that's not the case. Once she comes back, he will eventually again fall back to the same thing. Addiction does not have any relation to that, okay, I am drinking because of this. They may increase the use for sure, but then at the end, it is not the only cause. और मैं ना पंजाब जाता हूँ, I go to Punjab, so there is a lot of this misconception where people say कि, sir, if I will stop taking this opioid, which is a theme over there, I will have a stroke, paralysis, or heart attack. What happens? So I mean, they have their friends over there who just stopped suddenly, or they had some certain other issues. So the plan was that he stopped Afim or using the substance. That's why he had this stroke, paralysis. So that's again a misconception that if you stop, you will have major issues. And one last thing that I want to mention here is that a lot of people think and families think that addictions cannot be cured. That's not true. With the right approach and the physio and the psychotherapy, which Anne mentioned about, and with the right medications, one can get out of addiction and have a much better quality of life.
Yes, definitely, Dr. Garg. I agree totally with what you are saying here. Just to add on to a couple of myths or misconceptions here, there is a lot of misconcept or conversation that maybe addictions, men are more in numbers who are addicted to things or substances. Even if you look at data, it will say that men are more addicted. However, I would also say that there is a changing trend where there are more number of women also coming into the addiction pattern, especially nicotine addiction.
Yeah.
Right. So that is one pattern that we have been seeing, and definitely data as well as in clinical presentations, what we see is that age is also not a limitation for being addicted to different substances. A lot of studies do say that 13 on an average could be 1, 3, 13 adolescent could be an average age where people are starting to be getting addicted. And definitely in this age group, we might see more screen related addictions, anime related addictions, pornography addictions, gaming addictions, right? There are also substance abuses usually seen in this age group as well. So it is not based on a gender, it is not based on socioeconomic status, it is not based on age related factors. It is definitely has some thing to do with family dynamics and socio-occupational functioning of an individual, maybe. Right? So, like Dr. Garg mentioned, family, if there is a family history of drug use, then there is a more possibility of the younger generation also having some of these factors inbuilt there. So treatment also involves medication, psychological therapies like cognitive behavior therapy, motivation enhancement therapy, as well as social factors like family support plays a major role in helping people coming out of addictions. I think, Dr. Garg, we also need to speak about healthy coping habits or healthy coping patterns here, because a lot of people say that, oh, I just drink or smoke to relax myself. I watch something just to get the stress out of my system. Right? Even though these might not indicate addiction, what could be a lot more healthier coping habits which can replace these addictive patterns or habits?
Mhm. See, you picked up a very, very important topic, which is to do with this internet, social media, phone addiction, which is definitely growing up a lot in a big way. Like, I would like to say that I have had cases coming to the clinic where their average use was 10 to 11 hours per day. So when are they sleeping and when are they studying and when are they eating, right? So addiction consumes a lot of your time, lot of your life. Any which ways, an average person sleeps for 30% of his time in a lifetime, and the rest of the 50%, if you're consuming in addictions, then what are you left with, right? So from a very beginning, we need to set things straight. And like you said, usually these kind of patterns begin in the early childhood or adolescent age, right? That is when the brain is still developing. So the most important thing is to build good habits and lifestyle things at an early stage of childhood. Number one, adolescent age, young age group. Now, what could that be is number one, one needs to be more aware of the thoughts and their behaviors. Like just realizing, oh, I am doing this. Oh, I think it is affecting my life. Oh, why are my marks going down? Oh, I have been ignoring my friends and sitting back alone. Oh, earlier I would, meet my friends, go out and talk, but right now I'm just mostly involved. Oh, a lot of people, my family, my parents have been talking, कि यार सारा दिन phone पे लगे रहते हो and things like that. So awareness is very, very important, and that is after that you start working on the coping or stress handling things. Now, second thing is that all of us in our lives, it is not just addiction, but we are facing stress, anxiety, depressive, and other things on a day-to-day life. So learning basic stress handling and coping skills is very, very, very important for everything in our life, right? The first response of a stress is that it increases the level of cortisol in your body, and once the cortisol increases, it leads to lot of cravings, right? Now that craving could be, went out in a good way or in a negative way. That craving could lead to stress eating. That craving could lead to more smoking in under stress or alcohol or other substances. The second thing would be that you can decrease that cortisol level by healthy habits, which could be replacing that time period with a positive kind of an activity, which could be simple things like running, yoga, meditation, going and meeting your friends, reading a book, things like that. So one needs to get involved into that. The third thing is that I think everybody needs to start understanding the basic thing, which is anxiety. I feel anxiety is the first response to any such situation whenever there is a stress. So you start overthinking, you start having physical symptoms like palpitations or tremors or panic kind of a situation. You start getting sleep issues or insomnias, you know. So when you understand that you are having anxiety, which is a response to stress, so there could be various coping mechanisms that you can have is by improving on your lifestyle, sleeping in time, eating in time, and trying to consciously cut, that addiction patterns. For example, what I tell people is that try to have a tech zone in your house, like, where you have all your gadgets. Like I usually suggest people that TV should only be in the drawing room or one living room, not in your bedroom, because at the end you end up doing those things. If you are having a laptop on your bed, that means you might end up, watching Netflix or other kind of things for a long period. So let's not use bed for watching TV or doing these kind of things. So as every individual is different, there is no rule book where you tell them that do this or don't do that. But I'm sure if you give a thought process to it, you will definitely be able to do this. One of the most common complaints is that if I'm meeting my partner or my friends, I have a tendency to take out the phone and check every 2 minutes if there is a message or if there is any Instagram, message or things like that. So while you are interacting with people, while you are talking to your friends, especially in relationships, when you're spending time with your spouse or things like that, please try to keep the phone away, at least what we used to use in COVID, 6 feet away kind of a thing. So the same rule can be used here, that if you keep the phone away, you need to have these kind of things. And then there is also a concept which I usually tell people, which I call is deep work days. Like let us say once a month, one day you take it out as a deep work day, which is no stimulation, no distraction kind of a thing, where you're not using phone, you're not using any kind of gadgets, you're not getting into anything. So, and you can reflect back upon what you have been doing in the last couple of days and how it has been affecting, your life on day-to-day basis. So all these things can help you improve your coping skills. And whenever you can't do that, let us say you're trying but you're not able to, my advice is there is no harm seeking help. Talk to a psychologist. She will understand your personality, she will understand your family dynamics, and she will definitely be able to give you some solutions around your routine and what is the best way forward. That's what I tell people.
Yeah, definitely, Dr. Garg, being in the moment, present moment, which we call as mindfulness, because it's not only a meditation or a relaxation practice. Being mindful means you're being present in the moment, focusing on what you're doing in the moment. So, a lot of people watch screens while they're eating, for example. When you're eating, which is a complex activity, which is requiring all your senses, try and just eat at that moment, right? When you're having a conversation with somebody, it doesn't make sense that you're scrolling through your phone. Try and pay attention to that individual, have a meaningful conversation with them. So, being in the moment, also understanding or being aware of your thoughts, understanding and tracking where am I going more than required. Anything in moderation is good, but if it is going above and beyond, impacting other areas, should be able to aware and track this and keep a check on this, whether it is screens, whether it is any substances involved. So with this, Dr. Garg, I also want to speak about rehabilitation and rehabilitation centers as a whole, right? There is a lot of stigma, concerns, questions, and anxieties around that. People think that going into a rehabilitation center is like a bad thing. It's like there are a couple of my clients themselves look at it like going to a jail or a punishment. It's a punishment to them, right? Saying that, no, I don't want to be in a place like that, closed out from everything else and all of that. So, can you just walk us through what does or how does rehabilitation centers maybe help people to detoxify and build better coping habits and be able to reintegrate themselves into the society?
So the most important thing that we need to understand here is that rehabilitation center for addiction or mental health disorders is not what we call as or what we used to understand as Nasha Mukti Kendra, right? So these Nasha Mukti Kendras were started by, this social programs and social and welfare ministry to control these things, and because they would consider this as a social cause and an issue, but it's a disorder now. Everybody understands that, right? So rehabilitation center is not a Nasha Mukti Kendra, first of all. Now, when we say rehabilitation center for any such things, there are standard protocols and guidelines which include that the rehabilitation center will have a psychiatrist, it will have adequate number of clinical psychologists, they will have an addiction program, they will have support groups like AA or NA which are helping people quit their addictions. So rehabilitation center is fully equipped to handle these kind of things. Number two, that earlier people would think that it is a punishment, they are locked in there, they are beaten up there, or they are mistreated there. But the real rehabilitation centers, which are actually licensed by the mental health authorities, nothing of these kind of things happen there. Rather, it is not a punishment, it is a protection. You know what you have been dealing with outside, the rehabilitation center, and you are treated over there in a dignified way. And in a rehab, people usually think that in a rehabilitation center, that they are just put inside and the families can't meet them. But in the real rehabilitation centers, you are in touch with your families, the families come and meet you. In fact, in certain programs, we even allow patients to go out, attend to the meetings, attend to their work, and come back and stay with us. And once they are doing good, they have access to everything, laptops, phones, so that they can work, in an environment which is not causing any harm. The only thing is that one thing that you don't have there is access to your drugs or things like that. We are trying to set up that routine, we are trying to set up that discipline in your brain, like, you have various kind of activities. I mean, you won't believe that at home people sleep at 2 3, but when they are coming and staying with us, they are off to sleep by 10 o'clock. They get up at 7, they attend to yoga, meditation, sound healing therapies and things like that. And these days, rehabilitation centers are more like resorts and retreats. I mean, you can have the best of the facilities. Yes, the cost is a factor to that, but the usual rehabilitation programs in the country, good ones, you can find from 50,000 rupees a month to maybe 10 lakh rupees a month also. And also you mentioned NDDTC, which is AIMS ka center in Ghaziabad. I worked there for 1.5 years. So it's a very good center. There are no costs to that. The food that they serve, the hygiene, cleanliness, it's absolutely wonderful. And the people do not find any kind of difficulty. So usually this stigma is because, number one, this addiction now, this addiction is very, very complex thing. Even if the person wants to, the thought process, there are two minds in the brain. One is wanting to get out of it, and another is that evil mind which is saying, oh, don't go there, kind of a thing. I mean, even when you are recommending a person to go to a rehab and he wants to, you know what he asks us after 1 hour of counseling? Okay, sir, can I drink today and go to the rehab tomorrow? Because at the backdrop, there is that fear of, something going wrong there, being locked up for months and things like that. So there is a very big misconception that people, when they go to rehab, they need to stay there for a year, for long period. But that's not true. The usual time frame could be from 15 days to 2 3 months, depending on how much the chronic it has been, how much his physical health or mental health has been damaged. So ऐसा नहीं है कि you have to stay there for the rest of your life or long periods of time. So I would say that, I mean, I feel that all of us should go for a rehabilitation center for our mind, for our gut, for our body, for, let's say, a few days in a week. I mean, if that happens, and rehabilitation centers, you just go there, understand the program, meet people, meet fellows who have just gone through that program, and that is what will give you confidence. The moment there is one person who tells you, that, oh, it has helped me immensely, oh, I did feel like that, but now it is very, very different, it will motivate you further. And usually, people who are even brought forcefully, with the consent of the family members, and you will be surprised to know that within a week they turn, voluntary, because they start understanding that it is for their benefit. So it is not a punishment, it is rather a protection. And even families need to understand, because
Yes.
families are the one who say, oh, rehab nahi nahi wahan nahi bhej sakte hain, log kya kahenge, what will people say, where is my son, what will I tell my office, wherever I've been. These are the common things. They don't even want us to write that in their discharge summaries sometimes. So we have to remove that stigma. There has to be more acceptance at a patient and family level. And I would recommend that anybody who's not able to work on themselves, please consider rehab, a good rehab which is authorized by a mental health authority or a licensed rehab.
Yeah. So, Dr. Garg, because of the paucity of the time, I know the subject is very important and it requires a lot of in-depth conversation. We can take a couple of questions from the group already. There are a couple of questions in the chat. One of this is including the dopamine detox, whether it is a valid neurological concept or is it just behavioral reframing is one of the questions here. So maybe you can take that up.
Yeah. See, so dopamine detox is a concept. There is even a book by the name of Dopamine Detox. It's a very small book, that people go through. So it is the start and the beginning of a thing. So let us say initially you want to break any habit. So like you want to people go to Vipassana, or let us say you want to cut down onto your eating habits, or by going to a naturopathy center where you get that limited and a proper food kind of a thing. So that is what we call as an initial dopamine detox, which sets the foundation. But when it comes to addiction, just the dopamine detox is not enough, because being sober, being away from addiction is a long journey. I would say it is a lifelong journey. Like since you've lost control, you are probably never going to have it back, and you need to stay there. So along with the dopamine detox, the support systems, the community support, the family understanding, more than, I mean, as important as the patient, is very, very important. But yes, that is the beginning that you start with.
Yeah. So, another question is definitely if somebody is struggling with addiction and they are not self-aware and they are not willing to take any support or help, which is a common pattern we see also in clinical practice, right? Most people deny that they are having any addictions. What can be done in those scenarios or in those cases? From a clinical standpoint, I would say that the impact will be long lasting or long term only if the person invests in changing themselves and their patterns. The most family members, friends, and other supporting people can keep on doing is encouraging them to keep them off the habit, basically. But it's a very individually focused intentional effort which need to be coming from self awareness and the need to change this practice. So yes, you can keep on educating them, encouraging them, maybe taking them to a psychologist might help because they might speak about some concepts which might trigger them into thinking about taking support or help. So it's a long process basically, but it should be a self-aware or self-implicated pattern is what I feel like. So one question maybe,
Can I add?
Dr. Garg.
Can I
Yes,
continue?
absolutely, absolutely, you
So
can add.
this thing now, what I would advise is that if your family member is not ready to take the treatment, you as a caregiver go and meet the psychologist or a doctor and understand what are the options available. And I'm sure we have cracked cases where the family member came to us, the patient did not come. We sent a psychologist to their house. Number two is that we spoke to them over the phone, and the way the family was trying to approach them and the way we did made a difference. The rapport was built and the patient came into the treatment. And obviously, the third one is just before this webinar, I was attending to a call where the sister called me, was telling that this person is using cannabis, he's having psychosis, he's not ready for the treatment. What are the options available? So if they are not agreeing, you please go and meet the professionals and understand the options.
Thank you, Dr. Garg. Maybe one more question that you can take up is the question is to explain in layman language the mechanism of medicine which can help in the addiction.
Yeah. So usually we try to create a balance among two, three types of medicines. So the number one medicine, like I said, for a short period, we use the medicines that control the withdrawals and puts person at ease, like absolutely ease. Within 2, 3 days, they feel so fresh, right? And over a little longer period of time, which is like maybe from 3 months to 9 months, depending on the chronic use. So the one medicine that we use is any kind of anti-anxiety or mood elevators that keep your mood happier, positive, especially for people who are also suffering from anxiety, right? So that help. The second group of medicine is certain anti-craving medicines that control your cravings, and they are really, really helpful. I mean, if anybody says medicines can't help, they do help. Obviously, there has to be a little intent to work on those things. The third type of medicines that we use is are called as impulsivity control or mood stabilizer kind of the medicines, which are again safe to be used for a short period of time. Once there is a control over impulsivity and risk taking behaviors, so they help you remain sober and stable. And some of the medicines have been told, especially in opioid, like let us say I get a patient who has been using opioid for 15 years. So in that case, I might use one medication for, let us say, 2 years, 3 years, till that thing is absolutely washed out of his system. And once he gets back to his life socially, work-wise, career-wise, I'm sure he feels much better and he would not definitely want to go back to that stage. So that is the group of the medicines that we use. I mean, do not use these medicines. जो ये medicines लिखी होती है ना, शर्तिया शराब छुड़ाएं, वो जो खाने में डाल के घर वाले देते हैं, पुड़िया बना के देते हैं, mixing in a food. I usually do not recommend that. That can have side effects, and the patient will ultimately go against you guys also.
Yeah, thank you, Dr. Garg. So, to summarize what we discussed today, and maybe to reiterate and respond to a couple of questions more in the Q&A segment, what we need to understand is that addiction is a mental health disorder. Addictions can lead to depression, anxiety, or any other spectrum of things, or it can be the other way around as well. Somebody can have depression and then they start addictions. So it can be a two-way kind of a process. Where does addiction start is when people lose control over their time, their sense of money, or concept of how much they can do and they cannot do kind of areas. When they lose control, that is when addictions start. If we look at the family history or how addictions can be passed on, yes, family history can have an impact on addictions being carried on over. However, this is also dependent on each and every individual. How you start a de-addiction process is, first of all, something called as detox. Detox means that you're going to stop the addictive factor or substance, looking at it or taking it at all, right? Sometimes it's a controlled, slowly you bring it on. Sometimes it's cold turkey, or you just stop it and then take some withdrawal medication, anti-craving medication, other supporting factors like psychological help and social support systems to help you cope with these problems. What is the remedy, or how do you start stopping it? Is definitely building in self-awareness, building in more resilience in yourself, where you are able to manage stress and anxiety better. So yes, you can start as a maintenance or a positive health factor. Start consulting a psychologist, start speaking to a life coach to understand where you can start with it, understand a framework where you can be in a better coping and healthy mechanisms. And if required, do not hesitate to take medication or to go for a rehabilitation facility as well. So this is to summarize overall everything. We know we missed out maybe a couple of questions because of the paucity of time. I'm sure this is a long conversation you all will have to take up with your family, with your extended communities, with your mental health care professionals, including Silver Oak Health, or anybody that who you are willing to trust and take your time out with. Yeah. So Janvi, over to you.
Thank you so much, and Dr. Garg, for having us go through this entire journey, as this is a very important part of our understanding of different things. With that, we would like to wrap up today's session. We do understand we could not touch upon all the questions you asked us, but at the same time, we would request you to give us this space on a regular basis as you join us, as we share multiple different things with you. Until next time, once again, thank you all for being here. Thank you, Dr. Garg, for sharing your expertise with us. And thank you, Anne, for sharing all your knowledge with us as well.
Thank you, everybody, and thank you for this important topic to be discussed so much in detail. And obviously, it's a lot, you can go on and on. But just to tell the audience, we are there for you. In case you need help, just get in touch with us. Thank you.
Absolutely.
Thank you, everyone.